My name is Emma Foreman, and this is my presentation for my PowerPoint. I chose to focus on Chapter 10, where Skolnick discusses women's health as a global agenda. So I began my PowerPoint by discussing the importance of women's health. So in summary, women's health is important because women and girls are disadvantaged by discrimination based on various sociocultural factors. This can include issues like the unequal relationship between men and women in many countries, reproductive and healthcare rights, as well as domestic and sexual violence issues. So in order to fully grasp this issue, we need to focus on instances of mortality of women and girls in low socioeconomic areas versus high socioeconomic areas. So the leading causes of death of women and girls in low income and developing countries include, and they're not in order, are infectious disease, most commonly HIV and AIDS, heart disease, maternal conditions like sepsis, unsafe abortions, and hypertension disorders, tuberculosis, malnutrition, neonatal disorders such as prematurity and infection, and we also have chronic diseases such as stroke and cervical and breast cancer. So in high socioeconomic areas, the leading causes of mortality for women and girls are heart disease, Alzheimer's disease and dementia, kidney disease, diabetes type 1 and 2, colon cancer, lung cancer, and stroke. A similarity between the two is that heart disease has actually been the leading cause of death of both women and girls in low income and high income countries for 2 decades now. So as you can see, a lot of the instances of mortality in low income countries are preventable, and they do not happen in the United States and other developed countries commonly. Why is this? So in low income countries, there is a significant lack of access to medicine and vaccines, as well as healthcare facilities that have, can provide adequate care, and healthcare workers who have proper training. There also is the issue of proper hygiene and sanitation. Many people in underdeveloped countries are not aware of proper practices that can prevent disease. So one of the most notable organizations that's doing something about this issue is the United Nations. So the United Nations, UN Women, they have 17 Sustainable Development Goals. Okay, so number 5 is gender equality and the empowerment of all girls and women. So I chose to focus on this because I really feel like they have the best plan of action, and they focus a lot on health education and intervention, and providing that to women and girls in low-income countries. They also are trying to receive proper funding in order to build and establish facilities, medical facilities, healthcare facilities that really focus on maternal and sexual and reproductive health. So working on those issues would really help achieve the goal that the UN has in ensuring gender equality globally. So thank you for watching.